Mass cremations and burials have become the norm in a country where the bodies of coronavirus victims are piling up. Crematoriums and burial grounds are working day and night and even burning bodies in parks and car parks. Families of the dead mourn for their loved ones who succumbed not just to the virus but to the shortages of beds and oxygen.
The country, I am feeling very bad. I have money, I have everything, but I can't save my sister. Because no bed, nothing like that. No gas, no oxygen, no bed. Where we can do, where we can go.
International aid has started arriving, but family members of the sick are still lining up to find oxygen wherever they can. They say the government should have been better prepared.
If this would have happened like last year, then it would have been okay. Nobody knew about it. But they got a year and they wasted it completely on election rallies and all the other stuff. So it's heartbreaking, but we don't have any other option.
The World Health Organization said nowhere is the situation worse than in India.
India is really heartbreaking, as the Director General has said, and the exponential growth that we've seen in case numbers is really, truly astonishing. We have seen similar trajectories of increases in transmission in a number of countries. It has not been at the same scale, and it has not had the same level of impact and burden on the healthcare system that we've seen in India.
The World Health Organization also said mass gatherings contributed to India's surge in cases. But despite the rapid spread of the virus, Hindu pilgrims gathered again in the northern town of Haridwar for the Kumbh Mela festival. The government has been criticized for allowing large religious and political gatherings to go ahead. And both the central and Delhi governments have been accused of insensitivity to people's suffering and blatant inequality in setting their priorities. As people continue to die because of a lack of hospital beds and oxygen, Delhi's government is planning to convert 100 rooms in this five-star hotel to set up a COVID-19 health facility for staff at the Delhi High Court and their families. A controversial move it was forced to scrap following criticism from the public and the High Court itself. Elizabeth Puranam, Al Jazeera, New Delhi.
Well, Dr. Sumit Ray is head of critical care at Holy Family Hospital in New Delhi. He says the healthcare system in the Indian capital has been completely overwhelmed.
This whole situation seems totally devastating. Beds are full, ICU beds are full, all ventilators are occupied. There are no beds on in the wards. Our emergency room is full of patients. They have nowhere to go. Even if we don't have beds in the ICU, or on the wards, if we want to send them somewhere else, there is no organized way of sending them away. And all these patients who are there in the ER are all those who need high amounts of oxygen, or actually would need a ventilator bed or an ICU bed if they could get one. So that is the situation. We are losing patients we could save, because there is no access. I mean, the numbers are overwhelming. There are patients landing up in our emergency room, brought dead because they have been running from hospital to hospital in an ambulance or in their cars with oxygen cylinders, trying to get a bed, and they either run out of the oxygen or the oxygen was not enough for them, or their cases were so severe. So it's a devastating situation, absolutely, in that sense. Our young resident doctors, our nurses, etc., are totally traumatized by it. They are fighting hard. They are doing as much as they can. They are doing way more than they can, actually. They are working really hard, but they are devastated emotionally because of what they see, that they cannot save a lot of patients because we are running out of resources in terms of beds and ventilators and ICU beds particularly.